Welcome to this explainer from shadows to serialization. Today, we're plunging into a world that is just fundamentally alien to our own. We're stepping right out of the sterile, comfortable clinics we know today and diving headfirst into the truly terrifying, visceral reality of early surgical medicine. We're going to reconstruct the everyday world of our ancestors, and trust me, we'll see the absolute limits of human endurance. Okay, let's dive right into this. I need you to completely forget all your modern comforts for a minute. Seriously, erase the whole concept of a quick, painless trip to the doctor. Imagine living in a world where a simple injury or a disease or an infection wasn't just a minor inconvenience, it was an immediate existential threat. How did ordinary people actually face these agonizing medical interventions when pain relief was virtually non-existent? Their sheer resilience in the face of what we would absolutely consider torture today, well, it's a profound testament to the human will to survive. To really wrap our heads around this, we have to challenge a lot of our modern assumptions. Look at modern medical comforts versus the ancient Roman reality. Today, surgery is this exercise in silent, highly sterile precision. But back in antiquity, healthcare was actually startlingly precise, but entirely unsterile. We tend to view the ancient world as kind of primitive, but when we look closely at the physical evidence they left behind, we actually see this astonishing level of mechanical sophistication. It was all driven by this urgent, desperate need to mend broken bodies in a really unforgiving landscape. Take, for example, the artifacts recovered from the volcanic ash of Pompeii, specifically from what we call the House of the Surgeon. What was found was a 1st century Roman speculum, and the craftsmanship here is just meticulous. Someone literally spent weeks designing and hand-forging this bronze tool. But, and this is crucial, this remarkable precision was bound by perilously flawed constraints. Roman physicians genuinely believed in theories like the wandering womb. They were absolutely convinced that a woman's uterus could just detach and wreak havoc on her internal organs. So they had the mechanical skill of modern engineers, but it was paired with a wildly inaccurate map of the human body. Because of these massive historical constraints, the medical tools developed over the centuries became what we might look back on as an arsenal of agony. Just let this list sink in for a second. We've got the trepan for skull drilling, the lithotome, which is basically a claw for bladder stones, the dental key for twisting out teeth, and the tonsil guillotine. I mean, they sound like medieval torture devices, right? But remember, the men wielding these tools were not torturers. They were desperate healers operating without anesthesia, trying to save lives literally the only way they knew how. Let's look at the trepan. This was an 18th century hand-operated drill used to cut a hole in a conscious patient's skull to expose the dura mater. So if you had a severe headache or a depressed skull fracture back then, this drill was the cure. Just try to imagine the sensory reality of that for a second. You are completely conscious, being pinned down by assistants, and you can actually hear the shuddering grind of metal teeth biting right through your own skull bone. It is an agonizing thought for sure, but it's a stark reminder of the severe, everyday constraints that shaped people's choices for survival. And this brilliantly illustrates the sheer physical endurance required by the patient, which is perhaps best captured by the lithotome. The surgeon would use it to grip onto small bladder stones and pull them out, or use the blade to cut up larger ones, while the patient was totally awake. Imagine the excruciating journey of this long, claw-like instrument being inserted directly up the urethra and into the bladder. The surgeon had to just grip and pull out these jagged stones or cut them apart blindly inside the body, and all the while they were terrified of accidentally slicing the bladder and causing the patient to just bleed to death right on the table. Or ground yourself in the cold, heavy clink of the 19th century dental key. The claw would be tightened around the tooth and then rotated as if the user were turning a key in a lock. If you had an infected tooth before the discovery of antibiotics, that infection was quite literally a death sentence. To survive, you had to submit to this completely brutal procedure. They clamped that claw around your rotting tooth, and the surgeon twisted it with immense manual force, wrenching the tooth from your jaw. Patients routinely had to be strapped down for this. Brutal? Absolutely. But it was absolutely necessary for survival. So, what did a pre-antiseptic operation actually look and feel like? The operating theater before modern anesthesia was frantic, it was loud, and it was heavily steeped in the coppery stench of blood. The steps were grimly straightforward. Step 1, restrain the conscious patient with significant brute force from several assistants. Step 2, operate with lightning speed to minimize the agonizing pain and the massive shock to the nervous system. And Step 3, brace for the inevitable and very often fatal post-operative infection. In this world, speed was absolutely everything. In fact, speed was so highly prized that it leads us to one of the most legendary and honestly gruesome statistics in medical history. 300.
That is a 300% mortality rate for a single surgery. The story goes that a renowned, incredibly fast surgeon was amputating a leg, but he slashed so quickly that he accidentally cut off the fingers of his assistant and then slashed the coat of an observer who actually dropped dead of shock right there. Both the patient and the assistant later died of gangrene. So yeah, one single surgery, 3 deaths.
This absolute desperation for speed to prevent patients from literally dying of shock on the table directly led to the invention of the osteotome. This was a 19th century manually cranked device with a chain and sharp cutting teeth. Historically, it's actually the world's first chainsaw, invented specifically to speed up amputations. Now, as terrifying as a medical chainsaw sounds, and it sounds horrific, it was actually a profound act of mercy. It was designed to reduce surgical time and minimize the agonizing, splintering jolts of a traditional hammer, chisel, and handsaw.
Now, a lot of this brutal innovation was directly driven by the shifting landscapes of warfare. The introduction of firearms meant surgeons suddenly had to dig much deeper into the human body than ever before. This led to terrifying tools like the 16th century hollow rod bullet extractor. By the time of the American Civil War, surgical cutlers like Jacob H. Jemrig in Philadelphia were mass-producing these specialized surgical kits for the Army. The sheer scale of the war brought these brutal anatomical deep dives to thousands upon thousands of soldiers suffering out on the battlefield.
So the crucial point is this. Even though these surgeons could amputate a limb in mere seconds, they fundamentally, completely misunderstood the microscopic world. Drainage of laudable pus and inflammation were actually considered signs that a wound was healing properly. Doctors genuinely believed that disease spontaneously generated out of nowhere. They didn't wash their hands, they didn't wash their instruments. In fact, if a 19th century hospital ward smelled like the sickly sweet odor of pus, the doctors rejoiced. They called it laudable pus, thinking inflammation meant the body was healing itself. They were totally blind to the raging microbial war actually happening inside the wound. This total ignorance of the microscopic world created a really tragic irony in the material culture of the time. Just look at E.M. Hessler's amputation kits from the 1890s. They featured these beautifully crafted wooden and ivory handles, all housed comfortably in plush velvet cases. They are stunningly beautiful artifacts, but they were secretly harboring deadly, invisible bacteria. Every single decorative etching, every tiny groove in the ivory, and every little fiber of that velvet was an absolute paradise for bacteria. These beautiful kits were unwitting accomplices to mortality, carrying deadly infections directly from one screaming patient to the next. Let's move to the timeline of the sterilization revolution and see how this builds into the most monumental paradigm shift in the history of human health. It starts in the 1860s, when Louis Pasteur finally proves germ theory. Then right on its heels in 1865, Joseph Lister uses carbolic acid for the first time. But human institutions are stubborn, right? It took decades for American doctors to let go of their beautiful velvet-lined ivory-handled kits. It wasn't until 1881 that sterilization by boiling really becomes popular, and by 1885, metal sterilization bowls finally become the absolute standard. The shift from spontaneous generation to germ theory wasn't just a medical update. It required a total reimagining of reality itself. People literally had to accept that the very air they breathed and the physical tools they touched were swarming with invisible airborne microbes, and that these microbes were the true agents of infection. It completely shifted the responsibility of a patient's survival away from things like the will of God or the balance of bodily humors, and placed it directly into the unwashed hands of the surgeon. The pioneer here was English surgeon Joseph Lister. He deduced that killing fermentation-causing microbes with carbolic acid could drastically reduce mortality rates in open wounds. He realized that if you could just neutralize these microbes, you could stop patients from literally rotting alive in their hospital beds. But as you can imagine, this paradigm-shifting science met immense resistance. Doctors were hugely insulted by the implication that their hands were dirty. It perfectly captures the human hesitation to adopt a new truth, especially when it disrupts deeply entrenched traditional beliefs and social hierarchies. Now, what's really interesting here is how this scientific revolution profoundly changed the physical, material culture of medicine. Manufacturers began to make medical instruments entirely out of metal. This bowl, for example, would have been used to boil objects in the operating room. Because porous materials like wood and ivory just couldn't withstand boiling water, instruments evolved into these sleek, singular pieces of metal. This simple, unadorned 1885 sterilization bowl basically represents a total victory over unseen microbial enemies. It definitely lacks the ornate beauty of those old velvet cases, but its smooth, unyielding surface finally severed the chain of infection that had plagued humanity since the dawn of time.
We've traversed centuries of intense pain, sheer ingenuity, and profound paradigm shifts in this explainer. Our ancestors navigated a world of terrifying, everyday risk with an endurance that is just almost unimaginable to us now. So, I want to leave you with this thought. Knowing the agonizing, visceral, physical realities ordinary people survived just a few generations ago, how does their incredible resilience change your understanding of comfort, of risk, and the true meaning of a good life today?